of Mr. Mathew Kyeremeh. Now, this agency is mandated to regulate the facilities, indeed, register, monitor, license, a whole host of things. Indeed, many of us didn't know or were not aware of their existence until early this year when we heard that the Premier Hospital, Kolebu, might be shut down. So today I have the Registrar of the agency in the studio with me. We'll be looking at their mandates, their resources, and what the tale of the tape is when it comes to registration and compliance with Act 829 of 2011. Yes, that's what we're doing. If you have any questions, concerns, experiences, complaints you want to lay at the doorstep of this agency, my WhatsApp is 0244340437. Good afternoon, Registrar. Or should I say Acting Registrar?
Acting Registrar, that is correct. Thank you very much. Good afternoon, and thank you for the opportunity.
Right, we're glad you responded positively to our invitation. Now, like I said in my intro, a lot of Ghanaians probably were ignorant or unaware of the existence of the Health Facilities Regulatory Agency until you flexed or maybe you barked a bit. I don't know whether you bit anybody.
Not yet.
Early this year, we heard that our Premier Hospital, which indeed is one of the biggest on the continent, could face closure on account of, should I say, non-compliance with your regulations. So now we are aware of you and want to know a bit more about the organization. So if you can help my listeners with a bit of the background of HEFRA.
Yeah. Okay. Thank you very much again for this opportunity. I always believe that it's a good opportunity for us to talk about health and also to make this agency known to people. Like you just said, even certain health professionals are not aware of the existence of this agency.
Right.
This agency was born on the 31st of December 2011 by an act of parliament, which was assented to by the then president, who has now become the victor for the NDC contest to come again 2020, President Mahama, who he signed it on the same day. And obviously, because it was the last day of the year, we take it that it would not be able to do anything until the following year. So 2012, let's call it, around March, thereabout, the board was to be in place and or staff and other people. And the act, which is called the Health Institutions and Facilities Act 2011, Act 829, has got three parts. The first part is what this agency is about. It's called the Health Facilities Regulatory Agency, Part 1. And this agency was set up to license and to monitor all public and private health facilities for the safe and quality healthcare delivery for all Ghanaians.
Okay. Now, let me just hit on that again, okay, because it will come up. All public and private
yes,
health facilities.
Yes.
Across this country.
Yes.
Right.
Now, prior to this act coming into force, we had what was called the Private Hospitals and Maternity Homes Act. Obviously, that was 1958 Act number 9, amended in 69.
Right.
So you can see from the name that it was just to regulate private facilities. But over the years, there have been discussions and things. Why do we have two agencies? Who is regulating the public facilities and what is happening? Why don't we have the same kind of common standards for both public and private? Because it's health. It doesn't matter whether you go public or you go private. You should have the same kind of care. So the parliamentarians, as you said, they got themselves off the shackle, but I don't think they did. They still are in charge. They put into place this act, which brought both public and private health facilities
under one
agency called the Health Facilities Regulatory Agency.
Okay, right. So that gives us the history. That also effectively repealed the earlier act, Act 9.
It did, yes.
Right. So you are directly responsible for the registration and licensing of health facilities, both public and private.
Yes.
Okay. What does this entail? Let's go through the functions.
Okay. So you said we have four main core functions. One is the registration. And what is registration? Registration is when you approach us and you tell us that you have a health facility that you need, according to law, to get licensed. Okay. So we go through the law and the requirements. We have what we call the general requirements, which is what each health facility in the country should have.
Okay.
And then we go to specific requirement, which will be according to the type of facility you want to set up.
Yeah,
okay.
right.
So when we've gone through all the paperwork and we are happy that according to the law and all the things that you need to give us, we go to the next stage, which is inspection. So we will come to your facility if it's in fact, let me also explain this a bit. There are new facilities and there are old facilities. Okay. The new facilities are those that are about to start operating, because in fact the law says that you can't operate unless you're licensed under the act. But as you and I know, there were many facilities before the act came into being in 2011. So therefore those are called the old existing facilities. These are the ones that we will go and inspect, and if you are happy with the paperwork, after the inspection, if the result is positive, we'll give you a license.
Okay.
Obviously, for an old existing facility like Kolebu you spoke about earlier on, we'll give them a long-term license of 3 years. If it's a new facility that has come to us that I want to set up a maternity home, what do I do? After we've gone through everything and we are happy that you have got all it takes, you got the building, the infrastructure, the personnel, the equipment, the facilities that you need to have in the place, we give you a provisional license for 6 months.
Okay.
That can be given by me as a registrar, which is for 6 months. It can't be extended. And within the 6 months, we are supposed to come and have a full inspection to be able to recommend to the board for a longer term license to be issued to that facility.
Okay, great. If you've just joined us, it's 17 minutes past the hour of 2 on Joy 99.7 FM. I'm in the company of the acting registrar of the Health Facilities Regulatory Agency, an agency established under law under the Ministry of Health. They regulate and license and register all health facilities, public and private, in our dear country, Ghana. Now, we're going through the mandate, the legal mandate, and I've got loads of questions to ask him. If you have any questions of your own, you can WhatsApp them 0244340437, and we'll go through them as well. This is a very important agency. Indeed, you should be asking yourself whether the hospital you patronize is duly registered, licensed, and in good standing. I will further be asking the acting registrar what kind of register they keep and how can you and I access this register, because it's specified in the law that the minister shall prescribe the types of register they shall keep. But definitely in this kind of endeavor, a register of those in good standing is key and essential, a very salient, should I say, technical document of those who are in good standing. But let me just go through what I have in front of me. He's given us the functions, but it says the functions in the law of the agency are to receive, consider, and approve applications for licenses under this law, inspect and license facilities intended for the provision of public and private healthcare services, determine the basic and minimum equipment and personnel required for the type of service to be provided in a practice, regulate and monitor activities in a practice to determine the adequacy and standard of healthcare provided, collaborate with any other persons or authority to maintain professional standards in a practice, regularly assess health facilities for certification and accreditation, achieve continual quality improvement of healthcare providers, and perform any other functions that are ancillary to the object of this agency. Now, the agency, of course, like you mentioned, Mr. Kyeremeh, has a governing board.
Yeah, it does, yes.
Right? Constituted by or set up by the president.
The president, through the Minister of Health. Yes.
Okay. Now, interestingly, the constitution of the board, it says there should be one biomedical engineer, a representative of the Ministry of Health nominated by the minister, the registrar, which is yourself, 3 other persons nominated by the minister again, which shall include a nursing officer, a senior rank, a private medical practitioner. And then the president shall appoint the members of the board in accordance, blah, 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 and select one person to be chairperson. So we have a board in place.
We do, yes.
And it meets these criteria.
Yes, it does.
Okay. Yeah. Indeed, there's a website for HEFRA, isn't there?
There is, yes.
Right. Is it under the government agencies?
No, we have our own standalone website, which is www.hefra.gov.gh.
Right. Let me come back to the business. So we've passed this in 2011.
Yes.
Right. The same year we passed the Public Health Bill. Right. We've passed it. Okay, we're in 2019.
Yes, we are.
What has happened and what has been the tail of the tape when it comes to your regulation of health facilities?
Okay, before I come to that, you see, I said about saying that there were 4 main functions that we engage in: the registration, the inspection, and then the next one is we give you a license.
Right.
And I said about whether it's provisional for 6 months or long term for 3 years, and then we do monitoring.
Yeah.
The Act, I mean, I'm sure you read it somewhere there, says that the board shall cause to be inspected or to be monitored each facility at least once a year. So that's the 4th function.
Okay.
We do monitoring. And monitoring can be done on this.
At least once a year.
At least once a year. So
all the facilities.
All the facilities.
Okay.
All the facilities in the country, yes.
Right.
It's very important that we say that. The monitoring could be because somebody has been somewhere and they are not happy what they saw, or somebody has got some suspicions or whatever about the health facilities, and that they call our attention to it. And that is also possible. They can call our number, which is 0302 900 995. You can call us and tell us, look, I've been to this facility or I passed by this facility. I'm not very sure they are licensed, or I'm not very sure if they're doing the right thing. We would go there and find out what is happening. And then also
0302 900 995.
Yes.
HEFRA.
HEFRA.
You can complain straight. Is it a hotline?
We are working on having what do you call it, a hotline or what do you call those kind of lines?
Currently, it's office hours.
It's office hours.
Right.
Yes, currently office hours.
900 995.
Yes, 900 995.
Okay.
Then also saying, then you would also be monitored if it's your turn. I mean, as we said, periodically at least once a year, or if we want to do on a spot check, just in case.
So you have a schedule of inspection, monitoring, and all that.
Yes, we do that. Okay, so now coming back to your question as to what has happened between 2011, let's call it 2012. Yeah, let's be fair, to 2019. Now, I was appointed on the 8th of March 2017.
Okay.
And not much had happened, I'm afraid to say. And as I said, I inherited this agency, and I was told by even health professionals that they were not aware. So what we did in 2017 was mainly to try and sensitize people, get them to know about the Act, health facility to know about their responsibilities, and the public to know about what they can do to ensure that we can regulate our health facilities for the safe and quality provision of health services.
Okay, let me just come back to that. So 2012 to 2017, not much had happened. Does that mean we did not have a register? Register?
We did. I mean,
we did not have facilities in good standing or with licenses. We were not inspecting them. What does that mean?
We did. I mean,
I don't. It's a pretty loaded statement.
I mean, I don't want to be political. I mean, but the facts of the matter is that
this is a health program.
I know.
We're talking. No, hang on a sec. We're talking health facilities.
Yes.
You currently head the agency.
Yes.
And the law was passed in 2011.
Yes.
Okay. We crossed over the year into 2012.
Yes.
I'm trying to find out, because even under the Article 9, the 58 and 69 amendments,
Act 9,
Act number 9, right? There existed a register.
Yes.
Indeed, in the transitional provisions in the current law,
yes,
you were supposed to have carried over that register.
Yes.
And then expected that on expiry or expiration of existing licenses,
from the
facilities would come
prior to
into compliance with this 829.
Yes.
So when you say nothing had happened...
Well, unfortunately, I did not inherit...
There are no records.
I didn't inherit a register of any facility that have been registered under the old Act.
So essentially, what does that mean? Nobody was registered? Or nobody was registered?
Some people were... I'm going to come to that in a minute.
Wow.
I mean, the new law, 2011, the Act 829, said that when those which had been registered before by the Act 9, when their license expired, they should transfer to be licensed under this current Act that we're talking about. But unfortunately, the license that I have seen, I've cited off the old private hospital and maternity homes board, did not have any expiration date. Okay, that's the first thing I noticed. So, which therefore meant that if you were being pedantic, he said when your license expires, you should come to HEFRA. If it has not expired, why am I going to HEFRA? But I mean, I would say that the previous registrar tried to make the effort to ensure that these old facilities pass on to the new body. The thing is that I inherited 466 facilities that have been licensed before I came on the scene. And these were provisional licenses. And the reason for that was that there was nobody in place. So I don't know if you know this. There have been issues with the agency prior to 2017.
Right.
At one point, there was no board.
Right.
And then
with yours, when was your board constituted?
21st September 2017.
2017.
Yes.
Right.
Okay. So from then on, we can now begin to issue long-term licenses. We can now begin to do certain things that the board is supposed to do. The board.
So what you're telling us is that from 2012 to 2017, there was no board?
I think there was a board, but there were issues.
There was a board before this current board, chaired by the Dr. Felix Anya, Prof.
Yes,
Anya.
yes. I mean,
was that not a board?
Well, it was a board, but it folded. There were issues. I think there were issues. I wouldn't want
But it was
to,
a duly constituted board.
I think it was. I mean, I don't really have the facts to be able to confirm that. But what I know is that there was a board, but the board was not operational. There were some issues, and therefore there were no long-term licenses. And that's the point I'm trying to make.
Let me come back to basics for my listeners to understand. So what constitutes a health facility?
Okay, a health facility, according to Act 829, is outlined in the first schedule. The first schedule talks about all the types of health facilities, and then at the end of it, it says, and any other facility that the minister would deem fit to be registered as a health facility.
Okay, because
but for a very basic definition of a health facility, is any place that the general public or anybody goes to be taken care of, for their health to be taken care of. So if you go to a hospital to see a doctor, that's a health facility. If you go to a maternity home to deliver a baby, that's a health facility. If you go to a lab to get some tests done on you, it's a health facility. If you go to a diagnosis center to check certain things, that's a health facility. If you go to a pharmacy or over-the-counter medicine seller shop, which you call a chemical seller shop, to buy medication, that's a health facility.
What about a herbal clinic?
No, the herbal clinic, there is another board that deals with that. Yeah. There's the Traditional Medicine Council deals with the herbal medicine.
Great. I'm glad
you're talking here about the orthodox allopathic health. Yeah.
Now let me ask, because under the law again, there's a provision for the transition of records data from the Pharmacy Council to HEFRA.
Yes.
Because now you take up that scope as well.
Yes.
Has that been done? It says within 5 years.
Yes, it's not been done. I mean, the law says in Transition Provision 3 under Section 26.
Yeah.
That the Pharmacy Council shall transfer to the agency any information, knowledge, materials, and staff necessary for the efficient and effective performance of the functions of the agency within 5 years after the commencement of this act. We've agreed that the commencement was 2012, effectively.
So that hasn't happened?
That hasn't happened.
Is it a process in the pipeline, if I can use that
It is a process, I would say. Yes, it is a process that is being
So in lieu of that, is the Pharmacy Council regulating and licensing those facilities?
They are doing that.
Wouldn't that be contrary to the law?
Well,
the letter of the law as we speak?
I mean, if you talk to a letter of the law, yes, it is. But then if you talk about practicality, there are issues that need to be...
But, Registrar, with all due respect, there are several practicalities that would lead to illegalities.
Yes.
Yes. So the law specifically spells out what should be done. And I'm seeking to educate the public, but also make sure that we don't create gray areas for facilities and practitioners to, meander, right? So the Pharmacy Council is supposed to transfer its data and registration of all those things to you.
Yes.
Right?
Within 5 years it was
within
said.
5 years. Yeah. So maybe we can say, but is it something that is seriously being taken care of, or is there a turf war there?
Well, I would like to say that the board is in dealing with that. The board chair is in consultation with the board chair of Pharmacy Council.
Okay.
They are working on that. I would want to say that.
All right.
And I would want to assure the public that pharmacies and pharmaceutical facilities like the chemical sellers shops are not just being left on their own to do for nothing to happen. So the Pharmacy Council is doing something in that regard, even though the law says that should be transferred to HEFRA.
Great stuff. If you just joined us, 29 minutes past the hour of 2 already, but we're talking with the Registrar, Acting Registrar Mathew Kyeremeh of the Health Facilities Regulatory Agency. And we're learning what they do, how they do it. They give licenses, they inspect facilities, they register. They can give you provisional licenses. They can give you a longer term 3-year license. And it is also under the law illegal to operate such a health facility if you have not been duly recognized and licensed by HEFRA. And this brings us to, what exactly do you look for? What are the criteria? Owners and should I say managers, practitioners are required to apply to you.
Yes.
and submit quite a tall list of requirements and documentation. What do you look out for?
Well, as
or the areas.
As you read before, the process asks for certain things. Yeah, I mean, first and foremost, you need to have a structure, which is a health facility building. Okay, and we look for things like Environmental Protection Agency certificate that brings it environmentally safe to operate that facility there. You need to have a fire certificate to know that when people go in there, they're going to be safe. You need to have obviously health professionals or health personnel, and they should be duly qualified and in good standing with their professional bodies. In fact, the law makes it compulsory for anybody who wants to work in Ghana in any private or public health facility to join one of the 4 professional bodies.
Right.
So you should show us
the professionals working there should be in good standing with their
professional
respective bodies.
Yes, so they should have their licenses or their pins or whatever, which is current and up to. So we look at that. Then if you're going to be the practitioner in charge, we expect you to be 5 years post-college. You have to have 5 years post-qualification experience. And also to be in good standing with your professional body. Okay. Now we also look for the other aspects of infrastructure. Yeah. So things like toilets, convenience. If you need a fridge, if you need all those kind of things. So there's a tall order. I mean, if we want to go into
go through
any kind of a specific one, you would see that there's a kind of a tall order of things that they need to show us. Now they show us on paper. And then, as I said, at the right time when we go for the inspection, we go and see that if you have these equipment, they're functional. So I was told about the infrastructure, the personnel, and the equipment. And the equipment that you need to be able to deliver the kind of service that you say you want to deliver.
Right. Just to go further, reading for my listeners' benefit, it says, evidence of financial capability for the ownership and operation of the practice applied for. So you have to give some evidence of your resources to run the facility.
Yes, you need to show us that you have the financial capability of running a hospital or a clinic or whatever it is that you want to do. And I mean, obviously, you would have to have a legal entity as well. You have to be registered. If it's a private facility, you need to register under the Registrar General's Department. Obviously, if you're a public facility, then we can know that it's a government facility, so that is not the question.
I asked all this and I emphasized on detail because I need to push to give my listeners a certain appreciation or understanding of the resource you have as an agency. I've read documents which suggest close to 35,000 identified health facilities, right? Excluding the pharmacies and so on and so forth. Do you have the men, the women, the resources, the technical capacity to do this job?
Well, let's go back to the numbers, right? The 33,000 or something is kind of estimate. I mean, I am not sure as I sit here if the 33,000 are really facilities that do exist. Okay, so as I said,
meaning that you'd expect it to be more?
No. I mean, it could be less, it could be more. I don't know. The point I'm saying is that
Registrar, we have just from here to Accra New Town to Achimota. I'm sure within that radius, just Accra.
Yeah.
The number of facilities that qualify to be under your jurisdiction. So,
well, I mean, you know that,
and these are statements I've sourced from your statements and even the board chair.
I know. I mean, I say it's their estimates. I think anytime we say that, whether it's board chairman or myself, we say they are estimated. In fact, when I came into the scene in 2017, I engaged Ghana, the National Service Secretariat, and we got some 64 service personnel whose job was to try and go and ascertain that in fact these numbers are right. Now we were able to validate about 16,000 health facilities that we have records of. Now we also need to know that there are facilities for the Ghana government. So Ghana Health Service has got facilities. Pharmacies have got facilities. So some of these facilities are really not. We don't have the data in terms of. We owning the data.
For the data you have,
yes.
Do you have personnel? I know of a board and the head office here in Accra. You are supposed to, by law, have zonal health facility committees.
Yes.
Do we have these in place?
Unfortunately, we don't have a single zonal committee in place.
Wow.
In its place, we have a licensing review committee, which is based in Accra. That's not ideal.
So we are still centralized?
Yes. In that regard, yes.
it says there shall be established zonal health facility committees.
Yes.
And they process the primary application and then push
locally.
it out.
Yes. Unfortunately, we don't have that. But what we do have now is some existence in certain regions. So, for example, in the Western region, we have an office, we have staff there.
You have Eastern Ashanti, Western, and Greater Accra.
And the Volta region.
And Volta, yes.
Yes. Okay, so we have some kind of existence there where they try to do this. But obviously, those are not zonal committees.
Sorry if I'm being a bit pushy, but when you say some kind of existence, give my listeners an idea of what you have. If I go to Western region right now, who is there?
Well, if you go to Western region, you are very likely to find the person we call the regional supervisor or the regional coordinator, who is working currently with some NAPCO trainees. Because we have not been able to employ our own staff all over the country, we try to use the state structures. So NAPCO training program came into being and it came handy for us. So this person will have some NAPCO trainees. What they will be doing is to ensure that some of the things that we want to see, for example, check for the veracity of the numbers of facilities that exist in their region, to see if they need to be pushed to do what they have to do, to verify the data and things for us. So this is what I call some semblance. Because if we are to set up, as the law expects us to set up, to have a zonal committee, we need to have an office manned by competently qualified and employed staff to do that job. We don't have that at the moment, apart from the regions that we've spoken about now.
Okay, so
but even that, let me say this, for example, in Koforidua, it was a Nursing and Midwifery Council that ceded some part of their building for us to use. In the Volta region, we were able to go to Ghana Health Service to renovate a dilapidated kind of a structure. In Accra, for example, in Tesano, we are also at the mercy of Nursing and Midwifery Council, which has given us something like that. In Kumasi, we have two offices, one in Ayeduase. The Ayeduase one is something that the Nursing and Midwifery Council helped us with, a room. So in Kumasi also we have in Adum, Ghana Health Service has given us an office. So as you can see, that's why I said some kind of. You are patching at the mercy of certain people, which is not ideal.
You are patching and you are acting.
Yes.
38 minutes past you have to enjoy 99.7 FM. Interesting but somewhat alarming talk if you ask me. But there's good sense in setting up the HEFRA. They've taken up from an existing law, but it doesn't sound like they are tooled, and the teeth across the nation are not that many, and some are wobbling, right? And that is of concern to me. I've got this from Joel Kodo. He's the founder and chairman of the Society of Nurses in Endoscopy and Minimally Invasive Surgery. Joel says, I strongly suggest HEFRA pays some attention to endoscopy units and centers in the country. I've done quite extensive work in endoscopy services, and I've been to a number of such service providers in the country. I can tell you for a fact they are killing people in terms of infection prevention measures as well as client and staff safety. The problem, however, has been that a lot of people, including the health workers themselves, do not really understand what endoscopy services entail, hence do not appreciate the need for quality services. So he's strongly suggesting that you turn your lights onto that area as well. And of course, I'm sure there are lots of things when it comes to private labs, but even the public facilities. Right. Let me come back, read this from Trudy Bank says, please, I heard that from March this year, HEFRA will be issuing licenses to the chemical shops instead of the pharmacy council. Is this true?
Not yet. I won't say we are still working on that. So hopefully, in fact, if I had my way, it should be happening already. But I would say hopefully yes.
Okay.
I don't know.
Okay, you don't have your way. So
no.
let me Registrar, if I ask you.
Now, can you go back to the gentleman whose thing you read about the endoscopy services?
Yeah, sure.
Now, yes, we would want him, if he could provide us with some details of names. It's possible some of them have come to our attention. It's possible.
I have
contact. I was going to say before, you see, this is a big country. There'll be certain facilities that will be set up somewhere that we may not be aware. Some set up and close, and so that's why I talked about validation of the data. And I think that is something that we are doing now.
This is why I asked about a register.
Yeah.
Do you have a register?
We do have a register of licensed facilities, yes. Where they go through the process with us, we do have a file for each facility. On your website
as we speak?
On our website, you will find names of facilities, okay? that are in good standing or that
How
have got valid.
How are they in good standing?
Well, they would have a valid license with us, a license which is still valid, which is current.
Issued under which dispensation?
Under us.
Under HEFRA.
Under the current dispensation.
So you have compliant facilities who've gotten their licenses since HEFRA was set up.
Yes.
Right. What was the issue with Korle Bu?
Well, the issue with Korle Bu was actually you see, we have two types of facilities, public and private.
Not anymore.
Well, no,
Not anymore.
We do.
By law, they all come under you.
They do, but there are different types of facilities.
Yes.
What I'm saying is that there are types, public facilities by ownership and private facilities by ownership.
Right. But
now,
you chose to flex your muscle on the type,
yes,
the type I'm talking about.
Yes, I'm going to explain why.
Okay.
The thing is that with the private facilities, it's not been very difficult because they have been there even under the private hospital and maternity ones. So they know that they need to be.
And there's data there as well.
Yeah, there is data there.
Right.
I mean, if you can find them, there's data there. The thing is that with the public facilities, they are not used to being regulated by any other body but themselves or the Ghana Health Service or Ministry of Health.
Is the Ministry of Health doing that job?
Well, Ghana Health Service was.
Are they?
Yeah, Ghana Health Service
so
was.
They should have data.
They do. They do.
So why did you have cause to call out Korle Bu?
Well, as I said, the board said they wanted to sensitize and to talk to facilitators and see what is going on. So we decided to go to Korle Bu. The reason being that Dr. Asare, who is the chief executive, had started the process of registering with us, Korle Bu. Now, the idea was that there are certain issues because a public facility.
When did he start that process?
Oh, we are in February. I think he started in December. I personally sent the forms to him when he requested for it to his office.
But you barked in January.
Yes, because the board has got a kind of a timetable that we work to. Now, so January was when we were visiting facilities. Now, when we visited facility, Korle Bu was one of the facilities that we visited. It was for the board to appreciate the issues that may be confronting Korle Bu specifically. Mm-hmm. Number one, Korle Bu is a big facility, a big facility with its own issues of. You see, the Act tells us to get certificates of all professional. Health professionals that work in a facility, which means we will have to go to Korle Bu and check all the many health professionals that work there.
But you have the other act. You have the Medical and Dental Council. So if they give you their data, that's just a matter of data matching.
Well, they have the responsibility because we should not be doing data matching. They, as a facility, have the responsibility to give to us those people that they have employed and to confirm for us that those people have been competently qualified and they are in good standing with their health professional. Okay. So Korle Bu, for example, has got that. There are a lot of people who work there. They have also other parts. In fact, when we went there, we learned that there are 5 centers of excellence which don't exactly form part of Korle Bu as we know as a facility. So that's something that we learned. So it was for the board to go and learn if there are any specific difficulties that we would encounter in trying to regulate or license Korle Bu. That's why we went there. We did not go there to tell them we're going to shut the facility. But then this is a law which was passed in 2011. And as you know, if there's a law, anybody who falls foul to the law, and there are consequences. So it's just not Korle Bu. Okay. It's anybody else. It's just that we happen to be at Korle Bu.
So what is the current status of Korle Bu when it comes to HEFRA?
I had a conversation with the chief executive, and I think on the 12th of March, we are going to go and sit down and agree the date for the inspection. They have already given us some data that we require. They have to give us some more data. So we are hoping that when we meet with them on the 12th of March, we'll be discussing when are we going to do the inspection, how long is it going to take, who is going to be involved in the inspection, okay, who is going to help us, what's going to be your role as Korle Bu, and what's going to be our role. So we need to sit down and talk about all these nitty-gritty mechanisms and processes so that we can start the process of.
Great. It doesn't exactly give me the status of Korle Bu.
It's not licensed under HEFRA.
Korle Bu is not licensed under HEFRA.
No, it's not.
Okay.
Yeah.
So legally, what does that mean?
Legally, they're breaking the law.
Right.
Yes.
But you meet with them and discuss.
Well, I mean, as I said before, even though the law was passed in 2011, we are aware that there's a lot of catch-up that needs to be done.
Okay.
And we need to be reasonable and sensible and obviously work with facilities.
If I had a maternity home in Sukura, would you be that reasonable with me?
Well, I mean, if you let us know
In
what...
the interest of public health and public safety, would you be in that reasonable with a facility, let's say in Koko, Zongo or somewhere? Somebody has set up a clinic. He is truly rendering some service to the community. Because I'm trying to get my listeners to understand, and listeners, shortly I'm going to activate the phone lines 0302-216-541. Right? I've read the law, and I'm seeing that now public facilities fall under you.
Yes.
Right? So, and I've also seen that you've issued a statement which suggests that by the end of March you're really going to get tough.
Yes.
Right.
Yes.
But I'm getting a sense of a diluted toughness.
Well, I mean, let me say this. You see, the agency was set up to license facilities.
Right.
It was really not set up to close down facilities. Now, we need to understand that there were many facilities before we came into being, and we will not be able to do it all at one go. So we need to, as I said, be reasonable, sensible, but obviously people need to know that the law expects them to be licensed before they operate.
Okay.
Now, am I going to be reasonable? I don't know. Is that what the expectation of the public is, that we close down all facilities that are not registered under HEFRA or licensed? I don't think that's what the public wants us to. The public wants us to engage with them, to ensure and have some kind of a timetable, that by which time all health facilities will be compliant. And that's what we are working towards.
Okay. You hear from the public because my phone lines are active, 0302-216-541. You can talk to the Registrar of the Health Facilities Regulatory Authority, Mr. Mathew Kyeremeh. He's with me in the studio, giving us information as to what they've been doing, the kind of resource challenges they face. Nevertheless, they're still, should I say, very, very keen on enforcing the law, right? He suggests to us that they weren't set up to close facilities, but indeed facilities that are in default, article acho.
Yeah.
Right? So
That's
it's not that you set out to close them.
No.
They're in default.
Yeah.
0302-216-541. Dede in Maryland says, I need clarification. Does one set up a health facility before obtaining a license? Or if one has an intent to set up a health facility, would they have to obtain a provisional license before going ahead with the project? This is from Dede in Maryland. Doesn't the registrar need to do its due diligence to make sure the facility meets its standards and checklists before issuing a license to start the project? That's from Dede. So hold on to that question. Let me just see. There's a couple more. Please, good afternoon. I'm Getty from Awoshi. Please, I heard that from March this year, HEFRA will be issuing licenses. Okay, I've read that already. To the chemical sellers. Then this one says, I can provide you with names of, this is from Joel about the endoscopy.
Yes.
I can provide you with names of those facilities, but it's very sad to note that some of our big and respected teaching hospitals fall short of this. However, I think the issue has got to do with HEFRA spelling out specific requirements, including qualifications of personnel, and these must be adhered to. Joel, I'll give you a call. I have Dan in Osu on my line. Good afternoon, Dan. Hello? No, Dan is not on my line. 0302-216-541. So Joel says he can provide us with some of the names of the institutions. Somebody says, I understand they only operate in the south. They haven't been to other parts of the country. This is from Peter in McCarthy Hill. Chief.
Yes, sir.
Peter thinks you're only down south.
Peter, I'm afraid to contradict you. We are everywhere in the country. Yeah, we have people all over the country, and we have facilities that we have licenses in all over the country. Okay. We are not just concentrated on the part of it. But let me come back to the question of the private. If you said this lady who wants to set up a maternity home, and am I going to be tough on him?
With your permission, can I just take Ajiman on my line and then come back?
Yes.
Thank you, sir. Good afternoon, Ajiman.
Yes, I was. Afternoon.
Right. Share with us, please.
Yeah, I want to ask your guest, apart from making sure that a patient having requisite resources, do they also check how do they do their work? Because there's a certain clinic at Kyeremeh. They are alleged to be professionals of abortion. Once abortion too is illegal, do they even enter to get folders and get telephone numbers of those people who visit there, and sometimes call them, ask them of how they are being treated or how those people do their work at the hospital?
Okay. Right. Actually, that is spelled out in what I read, but Mr. Registrar.
Yes.
He's asking your modus operandi.
Yes, I mean, let me come back. I mean, as I was saying before, if there's a private facility somewhere, am I going to be that lenient with them?
Yeah.
And don't be too lenient with a public facility. You and I will know that a public facility like Kwalebu, like Ridge or Tema General Hospital, they have got a Ghana Health Service that is really checking to see that they're doing the right thing.
Okay.
So we can rest assured somehow that the public facilities are being taken care of somehow. It's just that the law has come to bring them all under this agency. With a private facility that works under nobody, there's a danger there. So if we are very serious, we should pay more attention to the private facilities, just in case there's something seriously going on.
I beg to differ, but let me take Sam in Tessano. Good afternoon, Sam.
Hi, good afternoon, Nortey.
Yeah, you're welcome.
Great. So the very first one is saying that.
Hello, Sam. Oh, sorry, I lost Sam. Hello, Sam.
Hello. Yeah.
Yeah,
I'm
go ahead
here.
quickly, please.
Okay. So I had wanted to say that look, we need to regulate both public and private and check on all of them. Government facilities can cut corners and bring so much problems, epidemics and so on and forth. But I wanted to discuss about when they inspect facilities. Apart from knowing they have this equipment and all that, the equipment quality, whether it can actually diagnose and do what it ought to do,
right?
is
Quality,
important.
right?
And then secondly, finally, even the equipment, refrigerators, when they go off, you need to have genset or solar or UPS.
Definitely.
All this, not just that you look at the refrigerator, it's on and that's it.
Okay. Great.
And including even ventilation in either bathrooms or where people sleep and all that. There are certain vent systems that we put in hospitals that make sure that there isn't any communicable diseases, floating around.
Great.
Right?
All right.
So,
thanks. I've got Stephen on my line. Good afternoon, Stephen.
Yes, good afternoon.
Good afternoon. Where are you calling from? Mankasim. Share with us quickly.
I think that there is regulatory failure on state institutions mandated by law to do a whole lot of things in Ghana. The examples are so many I cannot mention, but I think that we are often quick to pass laws in Parliament to set them up. But
That's right.
We don't give them the tools to work. So what's the point in making the law?
Yep.
And giving them names? You see, it's so annoying that the very people who pass the law will go to UK and South Africa for treatment and leave the poor person to die in Ghana. Look, these are serious issues that the man is talking about in your studio. That if people are not properly regulated, it means that they are practically killing people. That's what it is.
Right.
If the premier hospital in Ghana does not have a license to operate, then we are in trouble. That is what the system must go on the street to demonstrate.
Right.
That Kwalebu is not up to standard. If Kwalebu is not up to standard, how about the village hospital?
Thank you.
Are we really serious in this country?
Well, we're trying to have a serious discussion, but I can identify and I do agree with the bulk of what you said, okay? I couldn't have put it better myself. Thank you. Right. Now, Chief, I was disagreeing with you in the sense that the private clinic is also regulated.
It is, yes.
Right? And the Medical and Dental Council and other structures should be collaborating with you, and it's spelled out in the law that you team up with these agencies to make sure.
Yeah.
But the impression being created is that one, we have resource challenges, and I don't think it's an impression; it's a reality. And I'm hoping that the policy pushers and those who control the resources are listening to us. These are serious issues, right? But what kind of collaboration do you get from the other agencies? For example, a couple of weeks back, I had the Medical and Dental Council in the studio. There's this very topical and visible case of a facility that has been closed down and reopened by the owner or the professional and so on and so forth. Did you have any part to play? And part of that, which is in court, which I know, is under the 829 as well. Are you party to that suit?
No, we are not.
You're not?
No, we are not party to the suit. I think the Medical and Dental Council, as you know, deal with the professions and their practice.
Okay.
And I think they had issues with a professional there who is not on their register. and who they believe was practicing, and therefore he was breaking the law as the license that he requires each year to renew and to practice. So that's that. Now, with respect to
but with that, wouldn't your attention be drawn to that?
Of course, our attention has been drawn, and we've gone to visit.
Okay.
Yes, and the gentleman has come down. The owner has come down to talk to us, and he's been told to not to operate until he's got a proper license.
Is that a closure?
Well, we have not gone to close it.
When you say you've been told not to operate, what exactly?
Well,
everybody
is told.
You operate within the remit of the law.
Yes.
So you can't just tell me, it's like we're
no,
bossing.
but I can also tell you that Section 11 of the Act says a person shall not operate a facility unless the facility is licensed under this Act.
Right.
So there's a responsibility on the person who wants to operate a facility.
And
it's not for me,
responsibility
of course,
on you
to ensure.
Yes.
My job is to ensure. All right?
Right.
So therefore, what I'm saying, when somebody is told not to operate, that is all I can do. Until I go and find a person operating, I want to believe that the person is not operating. Now, if Medical and Dental Council had a reason to say that they were operating and to close them down, I believe they may have a reason why they did that. Okay. But what I'm saying is that with respect to it as a facility, is a health facility regulatory agency that would cause...
So you don't have due cause in that particular instance?
Well, we as I said, because it became national news, everybody got to know about this. So we had to get engaged.
I would expect that you would know before it became national news.
Well, yes, the Obenfo Hospital, if that's what we're talking about, yes, was in Mathew before. It came over to where it is at the moment in Wager.
Okay.
And they started the process of registering. And they also said the process is bringing some documentation, making sure everything is in place. But then also, as I said, because already it's an existing facility, they may want to believe that they have the license from the previous...
They want to believe.
Yeah, that they have the license from the previous act, okay, which they need to renew with us when that expires. Okay. So, I mean, I do not want to go into the merits of that case.
I just wanted to use it as an example because it's come up. Right. Yeah. Columbus Michael in Columbus says, please, is your office responsible for health insurance provider licenses in Ghana? And if so, what is the procedure to obtain one?
Well, I think there have been a few questions that we have not answered yet. But if we want to answer this one quickly, we do not give health insurance provider status to facilities.
Okay.
What we give is a license.
Okay.
And when the National Health Insurance Authority, which is the one in charge of giving insurance provider status to facilities, when they go to a facility, they are to ensure that those facilities are licensed by us before they can give them the provider status.
Right.
So that is a quick answer to that one.
And then those in arrears, the questions we have.
The questions in arrears, yes. The one about the endoscopy, and I mean, as I said, I would really want to engage with that gentleman to give me some more information.
I can link you up with Joe.
But I can also tell you that we would have specific requirements and things that we need to do to be able to ensure that what they're doing there is good, because we are supposed to be determining the quality of equipment and things like that they use.
Okay.
Now, the Ajeman was talking about facilities in Tema that is doing abortion and things like that. Obviously, they are breaking the law by doing abortion.
Can we give that number again, the landline? 900-955.
900-995. So 0302-900-995.
Okay.
But then, I mean, if Ajeman could also give us the name of that facility, I can assure you that from tomorrow, my officers would go and have a look.
I'm tempted to ask if you have a SWAT team.
We don't. You don't
send, I think this is where we need the macho men.
Yes. Well,
I'm just kidding.
I mean, because we are in a democratic dispensation, we do not physically go and close facilities.
But you have a technical team that can...
No, we liaise with the police. In fact, the police are the ones that can go and shut the facility down on our behalf.
When it comes to equipment standards, calibration and stuff like that, do you have a technical team to
We don't do that.
Who does that?
There will be a standards board to do all those kind of things. But when we go there, we need to ensure that standard boards had said this equipment is good enough to go.
Right.
So we check that.
Chief, our time is up, but look, I need to extract a promise from you. Next week, I want to go into a bit more detail on your, I want us to perhaps conclude with some movement forward. Even if it's a quick look at facilities in good standing, even if it's just Greater Accra.
Yes.
Right? Let's see how radio, indeed Joy FM, can help you move this agenda forward.
Yes.
So if we can have you next week, we'll go look at some of the stuff you do and some of your maybe technical or operations
Yes.
that you conduct? Because I'm getting a sense that there's a lot that
needs to be done, and I'm grateful for the offer to support us in that. Now, we have, as we speak, a list of facilities that are licensed and current and valid on our website.
Okay.
All right. Now, we are also, as you know, the board said we're going to try and work with facilities.
Yeah.
But by the end of March, there will be some action. The board is the one that will take those decisions, and we'll only try to implement them. Now, very soon we should be able to publish on our website facilities that are breaking the law. All right. Now, when facilities are breaking the law,
very soon.
Yeah, very
How
soon.
soon?
Well, because we give them out too much, so we just want. Yeah, so let's say after March. But then also, we've been to see the IGP. The police are on standby to support us. Now, if you read the act and section of the act, to tell you how a facility is closed down.
Okay.
Yeah. Now, I'm grateful for this opportunity, and as I said before, and let me ask now this question: the law does not allow you to set up your facility and operate before you come and tell us.
Okay.
You have to tell us before you operate if you're a new facility.
Okay, great. Thank you very much, Mathew Kyeremeh. I don't envy him, but it's a big job, and we've tried to bring their functions closer to you, but there are matters arising, and Ultimate Health will go into this next Sunday. We'll look at it, and I will plead with you, Acting Registrar, next week. If it's not a long list, or if you want it on our website, or you want it on Gazette, at least those who are compliant, please, let's praise them.
Yes.
Right?
Yes.
Let's praise them so that those who are non-compliant can now start looking at it. Thank you very much.
I'll be very happy to do that. To share
Thank you
that
very much.
information with you. Thank you.
Thank you so much.
Bye-bye.
Right, the chief of the Health Facilities Regulatory Agency, and the agency in charge of Sunday Rhythms is here. He says you could call him Iggy. My name is Nortey. I've been produced by Abeokusa Kofi. Stick and stay on Joy 99.7 FM. Up next is Sunday Rhythms. I'm out.